Good afternoon, everyone. I want to welcome you to the second part of our two-part webinar. I'm Katie Boyle. I'm the Director of Government Affairs for the Virginia Association of Counties, and I'm joined today by my colleagues Carrie Walker, who's our Director of Programs and Development, and James Hutzler, who's our Government Relations Associate. We're again hosting this event jointly with our partners at the Virginia Municipal League. I'll be handing the floor over to Janet Arison with VML momentarily to introduce our guest speaker. We just wanted to do a couple of housekeeping measures first. So many of you participated in the first part of this webinar, which we held on November 28th. So we'd like to welcome you back for part two. If you were not on the November 28th webinar, the recording is posted on our website. I'll share that link in the chat as well as in the recap email that will go out after this webinar, so you'll have both. This afternoon, we are pleased to welcome back Ryan Kelly from the Virginia Department of Social Services. As we discussed on the 28th, Ryan and his colleagues have been working for several years now at the direction of the State Board of Social Services to develop a potential alternative allocation model for local administrative funding. Ryan provided an overview of the proposed new model on the 28th, and today we'll be providing some more details. So a couple of quick housekeeping items. We are recording this session. We'll make this recording available on our website along with the slides. If you could hold questions until the end of the presentation, we'll ask you to indicate in the chat that you have a question, and then we'll have you unmute and ask your question. I think that worked pretty well last time because we got a bunch of people on the webinar. So I will now turn things over to Janet Arison with VML to introduce Ryan. So Janet, take it away. And I know Janet was having some issues with her technology, so I may just step in and do the honors. Ryan Kelly is the Assistant Deputy Commissioner for Policy and Administration at the Virginia Department of Social Services. And so under his portfolio, Policy and Administration is responsible for major support functions and business operations such as finance, procurement, facility management, and emergency management. Legislative and regulatory affairs, the department's Office of Trauma and Resilience Policy also fall under this portfolio. And I know Ryan has had a distinguished career working at the local and state and federal levels. And so we appreciate having him back today. So Ryan, thanks for being here. And thank you to your colleagues from DSS, who I think are also sitting in. And I'll turn things over to you.
Right. Well, thank you, Katie and Janet. Thank you for your work in putting together today's presentation and just for the great partnership that you've offered the department on this topic. Just want to double check everybody can see me and hear me. I cannot see myself, so if someone could just give me a thumbs up there or a nod. Okay, great. Thank you. Thank you. Well, again, my name is Ryan Kelly, and I am the Assistant Deputy of Policy and Administration, serving under Deputy Commissioner Gina Boyle here at the Virginia Department of Social Services. I'm here today to provide presentation number 2 on the department's draft formula recommendation. As you might recall from presentation 1, we provided a high-level overview, as Katie mentioned. And today, our intent is to go just a little bit deeper and provide a little more detail on how the formula works. That said, while we will share some new slides and go into more exact math on the calculation, you will hear some repetition from the previous presentation. And that's one, because we really want to continue to put everyone on the same page, especially those that might have missed that first presentation. And secondly, because again, this is not an easy conversation. It is riddled with complexities. So we do want to repeat some components to continue to build up the understanding of not just the formula change, but also the context in which this conversation takes place. We're going to follow a very similar slide deck and outline to presentation number 1. I'm going to briefly repeat these first 2 sections on the challenge and the background that we are working from. And then I'm going to discuss the draft formula itself, which again will include some repetition, but we will be taking off on 2 slides to show more exactly how the calculation works. From there, I will pivot to implementation and next steps. And lastly, we can close with your initial thoughts and feedback on the additional layers of today's information and any other thoughts you might have on the draft recommendation. So in terms of aspects and assumptions in this challenge, we start again by saying that this is a hard conversation, somehow coming up with something that works for the good of the whole, or as we say here in Virginia, the common weal. It's no easy task. And so the conversation about a base budget formula change always include admitting that a change will make allocations for some localities higher and other localities lower. That's why in the past, this discussion has come to a halt when considering a formula or implementation that would reduce even one local department's funding. Acknowledging that complexity and sensitivity, our proposal and recommendation will involve two important provisions that we mentioned in presentation one, and we want to bring those up again. We start by admitting that the current base budget is insufficient to meet the true needs of our local departments, and that inadequacy drives the tension around this change. So that is why we propose to accompany a new formula with a budget request to increase the overall base budget pot. As I mentioned in presentation one, based on the draft formula and the way we've calculated it so far, we expect that budget request to amount around $55.5 million. The other thing we want to be clear on from the beginning of this discussion is that we intend to keep all localities throughout this transition at their current base budget level. That means, again, acknowledging the sensitivities, the complexities, and dependencies that exist around this funding. Our plan proposes that there is no reduction to the current allocation level. Lastly, we want to open by saying that what we are proposing today, what we offer today, is a starting point when it comes to this draft formula. It's a recommendation. It is a proposal. We've had several iterations to get to today's draft, but we are not done discussing and thinking through what we ultimately submit. We think what we offer here today is a good evolution of our work to date, but that does not mean that it cannot change. You might recall a past idea on this subject, or you might suggest we tweak this or tweak that. And so I will say what I said in presentation number one, and that is that we are very open to hearing those ideas as this process continues. As we close this presentation, we will provide a way for you to continue submitting feedback. We still have a ways to go. With that said, let's run through some background to help set up what we are presenting today. We've said this in almost all of our presentations this year, but approximately 85 to 90% of the current staff and operations funding is allocated on an out-of-date formula that is so old it predates current staff. It's unclear what the formula is or was based on. However, it's also important to note that in the last decade, new staff and operations funding has been allocated based on caseload standards. This is only about 10 to 15% of the current staff and operations funding. In fiscal year 2023, the local staff and operations base budget was $512 million. That $512 million is made up of federal funds, state funds, and a local match of an average of 15% provided by the 120 local departments of social services. Although pass-through spending, which is federal and local funds only, play a significant part in staff and operations funding, we are only talking about reallocating the base budget. We don't take pass-through spending lightly, but we are strictly discussing reallocating the local base budget pot. There are only two budget lines in the base budget. We're talking about budget line 849, staff and operations with no local match, and then budget line 855, which does include that 15.5% local match. Just want to repeat a few things here on this slide. First, this is a conversation that has come up more than once over the last 30 years, and most recently through a State Board of Social Services request to Commissioner Duke Storen. This came back up again in 2020. That request led Commissioner Storen to establish the reallocation of local staff and operations funding working group. The work group was responsible for reviewing and evaluating factors that might go into a new formula, how equity could be achieved. And we were also charged with developing new allocation methods or models that include those new criteria. Lastly, we were asked to make recommendations to senior management regarding allocation methods and the implementation of those methods. After a change in administrations, some internal discussions, and an update to the state board, Commissioner Avula asked that we really hear from every local department on what they thought should be included in a new formula. And so this past spring, the department hosted 19 individual focus groups, and as an alternative, we also offered an online survey which asked the same questions that we asked in the focus groups. We had an 88% participation rate and collected more than 500 pages of materials to analyze. I just want to note that through the working group and through the several focus groups that we conducted this past spring, we've really tried to make this an inclusive and collaborative process with you, our colleagues and partners at the local level, and we will continue to do so. But when you look at these two bodies of work, the working group effort and the focus groups, what emerges are the results listed at the bottom of the slide. Caseload data should be used as a foundation for future formulas. Poverty should be taken into account, and so should fiscal stress. A new formula should drive toward equity, offer transparency and stability into the future, and as much as possible, be responsive to the needs of the local departments. Further, this conversation should include a wider audience for discussion and be implemented in a way that allows for time for localities to adjust to the new formula. Now, getting back to the formula. Again, we start with the premise that was established by the state board that we draft a new formula and make an effort to improve equity as we do. Again, what's emerged in this conversation is the direction to use caseloads in poverty and fiscal stress in design a new formula. And you might recall from presentation one that we looked at ALICE and alternatives like poverty case counts, and ultimately through discussions internally and with the working group, we decided that poverty is already a consideration within caseload data. So in terms of the actual math, that takes us to weighted caseloads and fiscal stress. As you know, caseload data is recorded according to federal information processing standards for the 20 programs tracked by VACMS and OASIS and other state and federal tracking systems. Using these results, you can view the percentage of observations sampled for each of the 20 programs, thus being able to weight dollars by program. Locality caseload data is then used to allocate staff and operations funding for each program by locality. The sum of each locality's allocation for each program equals their total allocation. Weighting caseloads can provide a more equitable allocation by taking into consideration variances such as the amount of time required to enroll a Medicaid recipient versus the amount of time it might be required to complete a CPS investigation. Again, this was a factor highly favored in the working group discussion and the focus group data. This is a new slide from the previous presentation, and it depicts how these caseloads and the funding might break down for a given year. 20 programs are listed on the left. The second column is weighting based upon random moment sampling results. In column 3 is the actual allocation from the full local base budget pot for that program. And to its right, the total number of cases associated with that program. As an example, foster care is made up of 13.4% of the moments recorded. Therefore, we took from the $512 million an allocation of 13.4 from that base budget for localities that had foster care cases. As you can see, this is based on the entire Commonwealth of Virginia, and what will happen in a like manner is that each individual locality's allocation per program will be based on that locality's number of cases per program as described in the previous slide. And again, adding up each program's allocation provides for the local department's total allocation. We also looked at how to include fiscal stress and ultimately looked at the Commission on Local Government's Fiscal Stress Index. The Commission on Local Government describes the Fiscal Stress Index as illustrating a locality's ability to generate additional local revenues from its current tax base relative to the rest of the Commonwealth. The average fiscal stress score across Virginia is 100.3, but in some cases as high as 106 or as low as 91. Higher fiscal stress or a lower ability to pay into cost is associated with a higher score, and low fiscal stress with a low score. The score was part of the historical CSA local match formula it's used by VRS, it's used by DOE and other agencies for similar purposes. While the index is updated annually in comparison to caseload data, there is a lag due to data collection. The index has three components, which are averaged together to produce a total score: revenue capacity per capita, how much tax revenue a locality could collect per person from its base if it used statewide average rates, revenue effort, its own source revenue collections divided by its revenue capacity, median household income, the level at which exactly half of the households in a jurisdiction earn more and the other half earns less. The fiscal stress score is designed in such a way that it is relative and was designed with the distribution of state aid in mind. So for example, a score of 100 indicates the locality has fiscal stress equal to the Virginia locality average. If a locality has a higher score than 100, that indicates their fiscal stress is greater, and vice versa. Now that we have some background on the key factors, let's get into the calculation. Again, we start by allocating base budget funding by weighted caseloads as discussed in the previous slides. With weighted caseload as a foundation for the new formula, we are proposing to address equity and each locality's ability to pay by including the fiscal stress score in the formula. We would map the most recent fiscal stress score available from the Commission on Local Governments Index based on FIPS codes to the 120 local departments. When FIPS codes need to be combined for some local departments, we create a weighted average fiscal stress score. Introducing this fiscal stress score into the formula modifies the weighted caseload allocation through an increase or a decrease in the final allocation amount. And this will depend on how far a locality's fiscal stress score was higher or lower compared to the weighted statewide average fiscal stress score. So what does this mean? What does it do? Well, if a locality had a high fiscal stress score, a score indicating it would be more difficult for them to generate local funding, they would be allocated an additional amount that is tied to their weighted caseload allocation and proportionate to how far they are from the statewide weighted average. And the opposite would be true for those who have a low fiscal stress score. They would be allocated slightly less than what they would have received if weighted caseload was the only factor included in the formula. The idea behind introducing a component into the formula that measures the fiscal stress of locality is that it recognizes that each locality may have more or less difficulty in receiving local government funding based on their distinct tax revenue, revenue collections, and household income. After calculating allocations based on the new formula, funding increases for each locality that would receive an increase are noted. These are increases in comparison to the current allocation. Funding levels are then reset so that the 2023 funding levels remain the same. The identified funding increases are added together to become the accompanying budget request, and if received, that funding would be applied to localities who would have received an increase under the new formula. Now let's break this down with a couple of examples, and here's what we're going to add to the previous presentation with two new slides. In this first slide, we're going to provide an example of a calculation for low fiscal stress. In example A weighted caseload allocation would have this locality receive $17.73 million. Now let's factor in their fiscal stress score using three steps. First, we determine their local fiscal stress score, which in this case is 97. In step two, we compare this score to the statewide weighted average fiscal stress of 100.3. And we do this by subtracting state fiscal stress from local fiscal stress. So in example A, we see that the difference between the locality's fiscal stress score and the statewide weighted average is a negative 3.3. We then convert that to a proportion or percentage by dividing by 100, and we're calling this the local fiscal stress adjustment. In step three, we multiply the local fiscal stress adjustment, by the locality's weighted caseload allocation. In this case, utilizing the LFSA will adjust down the allocation by 0.59 million, or roughly 590,000, and result in a final allocation of 17.14 million. Since the fiscal stress score was lower than the statewide weighted average, this locality would receive slightly less than they would have otherwise using only weighted caseloads for allocations. Again, this is not accounting for the reset provision mentioned earlier. Let's do it again, and this time for high fiscal stress. In example B, a weighted caseload allocation would have this locality receive 2.04 million. Now let's factor in their fiscal stress score using the 3 steps. First, we determine their local fiscal stress score, which in this case is 103.5. In step 2, we compare the score to the statewide weighted average fiscal stress of 100.3. And again, we do this by subtracting state fiscal stress from local fiscal stress. So in example B, we see that the difference between the locality's fiscal stress score and the statewide weighted average is 3.2. We then convert that to a proportion or percentage by dividing by 100. Again, we're calling this the local fiscal stress adjustment. In step 3, we multiply the local fiscal stress adjustment by the locality's weighted caseload allocation. So in this case, utilizing the LFSA, we'll adjust up the allocation by 0.07 million, or roughly 70,000, and result in a final allocation of 2.1 million. And again, this is not accounting for the reset provision mentioned earlier. The reset provision will adjust all localities back to their current funding levels. When we look at the impact of a reset provision, we see that slightly over half of local departments would be held to their fiscal year 23 base budget amounts. And based on these new allocation amounts, 57 local departments would expect to see an increase from their fiscal year 23 base budget. To be able to keep everyone at least where their base budgets were in fiscal year 23 and provide the funding to the 57 local departments who would have received an increase over their fiscal year 23 base budget, we'd ask to receive a 55.5 million in a budget request with a weighted caseload and fiscal stress adjustment allocation. In the focus groups and in the workshops, it was discussed and recommended that implementation of a new formula should be done in a way that allows for localities to prepare for the pending change. So in terms of implementation, we have drafted a model formula, a recommendation, and we have begun to vet these recommendations. And based on the feedback we receive through this vet phase, and to the extent we can, we will revise and review this draft into a final product. And then in July of next year, we would request approval from the secretary to submit a decision package as part of the annual preparations for the upcoming General Assembly session. The secretary would have to approve our request, and then we would have to submit a decision package, and then that would still have to be funneled through the decision matrix of the administration. We would hope that in the Assembly of 2025, in the session of 2025, the Governor and General Assembly would approve that formula change and the legislative and budget package that goes with it. As we mentioned in presentation 1, our intent would be to wait to implement this change for 2 years to allow localities to adjust to the new formula. We would see the formula change go into effect as part of the fiscal year of starting in July of 2027. In between 2025 and 2027, the department would work with localities to prepare for the upcoming adjustment. The formula will be updated every 2 years, and new funding would be applied through the new formula. In terms of next steps and feedback, we are working through our vet phase and are working through our second presentation. We hosted webinars with the central, northern, and eastern regions last week. Today, we are obviously meeting again with you, and tomorrow we will finish up our regional webinars with Western and Piedmont. So I know a lot of this feedback is contingent on knowing exactly how this formula affects your locality. And we are working on ways to communicate that. And I will say that just as a beginning, we are starting to take in different components of feedback pertaining to appeals on fiscal stress. So, for example, if there are major changes to a locality's revenue base, we should be taking that into consideration as we continue to think through this formula. While the current recommendation includes a budget request, the question has come up, what happens when there is an economic downturn? While the draft formula strictly pertains to the local-based budget pot, we've been asked to look more closely at how this might affect pass-through spending. This conversation often brings up concerns about unspent local base budget funds. And lastly, we have, since we've drafted the formula, we've been questioning how we can phase in this change, particularly as it relates to the budget request. And I will add one more here that we've been asked to look at how the number of local personnel in an agency could be brought into this conversation and in a new formula. Throughout the vet phase and at any time, you can email the department on the draft formula at this email address here, local based budget formula at dss.virginia.gov. This really concludes my presentation for today. I just want to finish by saying thank you again for all of your participation and engagement. This is a challenging conversation, but your partnership and your engagement has really helped define how we go about this change. And at this point, I would like to open it up for discussion and any initial feedback on the details that came out of today's presentation.
All right, well, Ryan, thank you again. So I think we'll open it up for questions. And since we've got a lot of people online, if you can maybe just, type, I've got a question in the chat, and then we can call on folks to unmute themselves and ask questions. And in the meantime, I'm going to post in the chat the link to part 1. All right, looks like we got a question from Pamela Littlehill. Pamela, do you want to unmute and ask?
I can answer that question, Katie. The fiscal stress numbers are actually available today. They are in the most recent Commission on Local Government's Fiscal Stress Index report. I might not be titling that correctly, but this is available online. I don't know if we posted it last time, but those fiscal stress numbers are available today, and we can get you that information.
Okay. Next question is Glenn Loop.
Yeah. We have not made public the list of 57 jurisdictions that would experience an increase at this time.
Okay. All right.
And Susan Gode's question. So all this is contingent on the governor and General Assembly approve. We are working through that communication, that this is something that we're working on. They understand that I think they understand that this is a conversation that's been taking place over the past couple of years. And they will need to approve it, but we've not submitted this in a formal way to begin activating that process. And Katie, I think we're going to make these available just after today's presentation, the slides.
That's right. Yes, just for folks on the phone, Lisa Peacock was asking when these slides would be available. And so my intention is once we get the recording processed, I can send a link to the recording and the slides out shortly thereafter. So hopefully by tomorrow. And then Janet just posted the Commission on Local Government's Fiscal Stress Report link there, and we can send that link out afterwards as well. Yeah.
Yeah.
Go ahead, Ryan.
I'll read it out. If implementation, this comes from Shell Douglas, if implementation is expected in fiscal year 27, and we will be held to a fiscal year 23 budget level, that is a potential of being 4 years behind. And that is correct, Shell. I would just say that, our intention right now is to, yes, introduce this in 27, but to utilize data, the most up-to-date data at that time, to include the budget at that point, the base budget at that point. So when we talk about this in today's presentation and the presentations in the past, we're simply using 23, and I haven't made this as clear as I could be, so I apologize. But we're really talking about using 23 and 21, 20 data that you saw presented today as an example of what this would look like should it go into implementation. But we would be using data available at the beginning of that fiscal year. So I apologize, I did not make that more clear. I've heard that before. So.
Other questions? Ryan, I have one for you if no one else does. I know you're still kind of collecting feedback and maybe working through some other questions. Do you all have plans to kind of reshare sort of an updated version before you move forward with it? I mean, maybe you could talk a little bit about kind of the process moving forward.
Yeah, it's a good question. We don't have a strictly defined path going forward. I think, we're really waiting to see what comes in terms of feedback and what we need to work on or work with going forward. I do anticipate, after having these presentations and some of the questions we've received, you saw the short list of considerations we've had so far, that we do come back with an update on, where we land through all the vetting and through all the review of that vetting. And so I don't know exactly what that looks like just yet, but I would anticipate that we come back in some fashion to share where we go prior to going to the administration.
Great, thank you. Other questions? Ryan, is there a time by which you sort of need feedback submitted?
Yeah, we'll make that more clear in the near future. I think right now, again, we're sort of saying, through the end of January and February, and then in the late spring, we'll start looking at what we have to make changes. But we'll put out a formal due date, like I said, in the near future. And I would just, reiterate again, we would love to have that feedback. We do consider this a draft. We do consider this a proposal, a recommendation, and we want to get it right before we go forward. And so, the more input we can get, it makes our job a little more difficult, but we would rather go through this exercise and really continue to think it through before going forward. And so please do not hesitate to share.
Great. Well, it looks like questions have slowed down, and I think people are still perhaps digesting what you shared. But I want to thank you and on behalf of VACo and also on behalf of VML. I think Janet's still having some issues with her phone, but we do want to thank you for your follow-up presentation and for walking us through your proposals and for soliciting feedback from localities, because we very much appreciate that. And so with that, I will be sending out the recording, the slides, link to the recording from the 28th, and also the Commission on Local Government document that Janet shared. So look for that in your inbox shortly. And Ryan, thank you again. We appreciate it.
Cool. I'm happy to hang out as long as needed. So if not, happy to drop too.
All right. Well, it looks like we're seeing some appreciation, some thumbs up, and some applause. And looks like no further questions in the chat. So we'll let you go, but I'm sure we'll be talking more soon. So thank you, everybody, and we'll be adjourned for now.